meeting to order. With that, I'll entertain a motion to approve the minutes of last month's meeting. Supervisor Soto, seconded by Supervisor, I think I saw McDevitt. Any corrections? All those in favor? All in favor?
Aye.
Aye. Opposed? Carried. What's that?
Kind of feedback from the computer, I think.
Okay, starting with Veteran Services, Denise. Okay.
Yeah. Thank you very much.
Thank you.
Bridge crossed. Thanks, Denise.
Okay.
There we go. Banana.
Pretty early.
Had a day already.
Good morning. We're all set, Denise.
This is the 2019 budget. There's not many changes listed. Most of them are within the contractual expenses, and only by a couple of bucks here and there. The only thing significant that went down was the gas and oil, thanks to a new van. Okay, so we did reduce that by $1,000, and the only other thing that has gone up, significantly from past years would be the advertising fees. And basically, we just moved money from moved things around from one account to the other in order to absorb that. So overall, I believe in the contractual expenses, you're actually going to see a reduction from the past year, still, even with the reallocating the money around.
Okay. If any board members have any questions, or committee members, make sure you address Denise with those now, please.
Chairman?
Yes.
On your revenues, so the state aid totals, you want to talk about, are you getting what you were supposed to be getting through all these years?
I do believe so, per the set guideline, and it's not actually, is it a revenue? It's state aid. It's a state aid of the 8529, I think it is.
Mm-hmm.
Per the current regulation, I believe we have been getting, what was allowed, but going for in the future, I do believe they're trying to reassess how they divvy the state aid out per county, based off from how many claims are being developed through a certain county and that kind of thing. So I'm not sure. I believe it's sitting at the Senate. If you wouldn't mind.
I can speak to that.
Thank you.
Under the current formula, we're not getting the full amount that the law would entitle us to get, but that's only because the state is not fully appropriating it. There's Article 7 language that states how the money is to be distributed, but it's out of a gross total that goes statewide. So I think when we make claims against this revenue, basically first quarter, second quarter, our revenue is exhausted, and there's no point in putting in further claims. So if the state funded this better, we would certainly get more under the current formula, and as Denise mentioned, there is a legislative effort to revise the formula.
Thank you.
Thank you. Other questions? If not, then I guess, Denise, we're all set.
I love it. Thank you very much.
Thank you.
Thank you, Denise.
Okay, good morning, everyone.
Good morning.
We have an amended agenda. The first item on here is a transfer of funds request. See on the back of the agenda, request for transfer of funds. Amanda has the signed copy and made the meeting packet up before we signed the form, but basically what this is to address is current budget situation with psychiatric evaluations, criminal. And there's a table on the next page that shows where we are year to date. This line. We have 25,000 budgeted. It's the lower portion of the table there. And out of this line so far this year, we've paid 14,866. However, we have pending invoices that you can see below there for 10,744 and 13,212. So what we're proposing here is we took a look at our budget and we want to do some transfers to address this. So we're transferring some funds from lines for miscellaneous fees and expenses over to that in the amount of 4,330. Office equipment, 700, and psych eval non-criminal, 2,000, for a total of 7,000, approximately 7,000, a little more than 7,000. We would still need to request some contingency funding as well, which is at the bottom portion of the form, 17,970. These are mandated expenses. These are for individuals that are determined to be not competent to stand trial. They have felony charges. When you have felony charges and you're not competent, you're sent to a state hospital for a restoration process. That can usually last 30 to 60 days. In complicated cases, sometimes it lasts even longer. So these are the billings we have in for this year to date, and so we need to be able to pay the invoices, transfers.
So we need a motion then first for the transfer of the funds, right? Supervisor McDevitt, we're going to make that motion. A second to that motion, Supervisor Bramer. Now any discussion, any further questions?
Just maybe an observation. Did you want to say something?
Yeah, I forgot to also mention that also on this form is the additional requests of the consulting fees to retirees hospitalization and office equipment to retirees hospitalization. These transfers were requested for a different purpose, of course, but at the request of the Treasurer's Office to cover our actual expenses for retiree hospitalization.
Okay, thank you.
Okay, just maybe a comment. In terms of psychiatric evaluations, going to Utica, I assume it's really not an issue where you have much control over. I mean, it's a court-mandated scenario. You're faced with a situation. You send that patient to Utica, and the bill shows up. Some years low inventory. Some years we don't. Okay, and it just it is what it is.
Yeah, it's very hard to predict, and
we're almost, the original budget was 25,000, and we're looking to transfer 24,000 more, so that's doubled. Is this a trend? Is this just an unusual blip?
I would say it appears to be a trend, but again, you know, it's pretty variable year to year. Over the course of the year, it seems like our requests for 730s are increasing. since the last half of last year and this year. We did, during our budget discussion, well, you'll hear it in a few minutes, we did, for next year, talk about maybe setting that a little bit higher, maybe about 40,000, just because of it does appear to be a trend.
All right, anyone else? We also have down here where we had the contingency fund, you're making a request there too, right?
Yes, and that would be for the balance of what we think we need to be able to pay these two invoices, and we know for sure that there's another invoice we will receive for somebody who was in there in August.
All right, is there any objection from the committee if we put both of those requests together? The transfer that we talked about first, and then from contingency, it's going to have to go on to finance anyway, so is there a problem if we put those both together? Is that all right, Mr. McDevitt? This is right. All right, all those in favor? Aye. Opposed? Carried.
Did want to check first, though, do we have money in the contingency account?
Currently, there's a balance of $141,968. We need to take, well, there was an allowance for $50,000 made last Friday to pay railroad taxes. Won't be that much. It'll probably be low 40s. If it was the entire $50,000, that would leave us with $91,968. The initial request was for $25,000, and I want to thank Rob for really digging into his budget to see how much of that he could get out of his budget without coming to contingency. Thanks, Rob.
That'll get taken up at finance then.
That's right.
Thank you. All right, Rob?
Okay, so moving on then, second item we have is review of the 2019 departmental budget submission. I think most folks know Harry Carlson is our Deputy Director Fiscal, and Harry is going to walk us through the budget submission.
These are the contracts that we have. Good sheet on that.
Yeah.
In our actual administrative budget for the local governmental unit, there were a couple of small increases and decreases, membership fees or telephone. We cut the membership fees down a little bit, telephone increase, so pretty minor changes there. One of the big changes on the administrative side was that we're finally starting to get a better handle on our federal salary sharing, which is basically whenever we deal with the Medicaid program, and the federal government would actually give us some money for that.
Could I just ask you to speak up a little bit? I'm sorry, but I can't hear back
I'm
here.
having a hard time, I'm right next to him.
Okay, all right, so it wasn't
here.
just me.
Okay, project. The one thing that we are starting to get a better handle on is our federal salary sharing. Right now, we're estimating right around $70,000 a year. Prior to this, we were estimating right around $60,000. They instituted a whole new process that involves where they send us moments, where we can get a moment at any time, and we got to tell them what we're doing, what kind of program we're dealing with, and that actually creates the federal salary sharing, how much we get. And we have to file quarterly reports of our spending. Like I said, right now we're up around $70,000 we're estimating in the budget, but they're doing a lot of catch-up. Just to mention that they're doing a lot of catch-up. Like this year, we've had, I think we've totaled maybe $125,000 we have in federal salary sharing sent to us, each of the counties, and that's based on actually 7 quarters. So they're playing catch-up, and it's good for us, but hopefully it'll start evening out so we can, anticipate the amount of revenue that we're going to get on that side of things. So I mean, it's as far as our administrative budget, that's pretty much it. On the contracts, you'll see that there have been increases for next year for the agencies. This is entirely 3.25% salary increase that the state awarded the agencies for direct care staff and clinical staff that they have on. And the number there represents basically the annualization of the money because this year they got 3/4 of it. Next year, of course, that number is annualized. One thing I want to point out too is on the change in the county tax, is that since CWI no longer is allowed to do the workshop, and they've actually transformed the workshop into something else, that we're giving back the right around $7,500 in county tax money that used to go to the CWI. So that's basically reducing the overall charge to the county on that. And that's basically it. Pretty straightforward budget, actually, I think. You able to hear me?
Yeah.
That was better.
I just want to look over it for a second.
Yeah, just give us a minute, that way if a committee member has any questions, they can
Sure.
ask.
Yeah, on this spreadsheet, first two columns were expenses, the amended and proposed, 2018, 2019. And then you had revenues, funding and revenues.
Yes. Revenues are basically all the state aid we get, and with the, like in our particular, like, the community services budget, that's a combination of federal salary sharing, ISRA, and the state aid that we get from the work.
Does our revenue side reflect the 3 whatever million that's supposed to be distributed by the state for mental health? You know what I'm talking about?
Yeah.
Sure.
Okay. So, I think it was for mental health in jails, Rob, what we were just talking about. The Sheriff's Association and others had requested 12 million, but the state, I think the budget was,
Okay, no,
ended up
we're
being...
not getting any of that funding.
We're not getting any of that funding.
No, they selected certain pilot counties, and I could get you the list, I don't know off the top of my head, but we were not one of the pilot
Oh, I
counties.
thought they were at least going to throw us a bone like something.
No, they decided, since the original request was 12.8 million.
Yeah.
And then approved was only, I think, 3.4.
Right.
They decided, instead of spreading it across all the counties, that would be too small of an amount for a lot of counties to really do something with, so they decided to select pilot counties, see what kind of programs work, and then come back at it, look at funding, expansion of programs that are working.
And that was for the mental health services in jail?
It
Is that
was
correct?
actually, it was called substance abuse services
Oh.
in jail, but it included like a transition release component, kind of like a transition coordinator who would help people arrange for services on release.
Right. At this conference I was at, they talked about a soft handoff from the
Yep.
jail right
Yep.
to your first,
Yep.
outpatient, or not outpatient, but your first clinic visit.
Right, and that could include mental health. I mean, whatever the person's needs are in terms of substance abuse, mental health, treatment.
Okay, so we got nothing.
Yeah.
Is the bottom line. Great. Perfect.
Well, question.
Thanks. Parsons Child and Family, what's our relationship?
Okay, so we have several contracts with Parsons. We hold contracts with them for both adult and children's mobile crisis. They also do an in-home crisis program. It's kind of like a little bit longer term. It's actually kind of short-term treatment, but it's intensive in-home, or they go in and work with the family intensively in a home for maybe a 6-week period or something. We also hold a contract with them for an ACT team, which is a sort of community treatment, and they're still in the process of bringing that program up. But they also are providing clinic services for us in a number of schools, and that's not actually included in our contract because that's funded in another way, but we still interact with them around and approve their services in the schools for clinics.
Thank you. Thank you.
Any other questions? All right, if not, we'll move on to the next item on the agenda, Rob.
Okay, next And on my agenda is just an informational. I had received a permission for travel in September, so thank you everyone for that. I did travel out to Rochester earlier this week. Our statewide association had a full membership meeting, and that's when all of the directors of community services get together. We do that twice a year, and so I included a copy of the form and a copy of our agenda there. Good meetings and some focus there on forensic services as well.
Okay, good. Anybody on the committee have any other questions? Rob, anything else?
I just have one other item, I guess. I'm looking for a little bit of direction from the committee. I wasn't sure if I needed Board of Supervisor resolution committee approval for this or not. One of our employees, Carrie Wright, came across a training opportunity. We don't usually send staff out of state for travel. We just generally have sort of an internal policy of not doing that. But in her various work with DSRIP and everything, she came across New York State Health Foundation has a grant program, and they will pay for the training. There's a national conference held in California in November. It focuses on evaluating health programs and public health and mental health programs. And, you know, I talked with Carrie about it and said, you know, basically, you know, I would not be in support of us finding funding for this. But if she could find outside funding, that I would, you know, bring that to the committee to determine if that's something we should move forward with, or tell her, you know, sorry, look for something closer to home.
Was she able to come up with any funding, or is this what she's still working at?
Well, there's an application process for the funding,
Right.
and that application would have to be submitted relatively soon, like within the next week or so. And I have to sign off approval on that application to the New York State Health Foundation.
So what is the feeling on the board? Ms. Bramer?
I'd say she should definitely seek the funding, and I would even be willing to support using money to help her go.
Anyone else? I agree with Ms. Bramer. I think we should certainly encourage her to do that. Supervisor Sokol?
Not sure. How much are we talking about here?
And again, I'm sorry, I don't have all the detail of it with me today, but I believe that it's somewhere probably around $1,000.
I would say go for it.
All right, then we need a resolution.
I mean, the travel policy,
Even though it's
review the
paid-
travel
gonna be paid
policy,
for,
and
right.
generally it does say that out-of-state travel requires a Board of Supervisor resolution. So I guess my request to the committee would be to advance it on to the Board of Supervisors as a request for out-of-state travel contingent upon
Her receiving the funding that she needs.
receiving the grant award. Yeah.
Rob, what's the date of the travel? Do you have that handy?
The dates of the travel I do have, and that is November 10 through 14.
Okay. And do you think that we'll have all the details together by the October board meeting for purposes of what the resolution needs to say?
Absolutely.
Okay.
Could we have it before finance, so we can figure out, I mean, if we need to have a source of funding, if she doesn't raise,
I don't
mean,
feel comfortable passing something like this
Yeah.
in it without the details.
When is the finance meeting?
next Thursday, I believe.
Right. A week from today.
Well, I'm under the wrong, I was assuming she's trying to get the funding through this grant. I didn't, you weren't coming to ask us for the money for it, right?
Correct.
Right.
My request is making the approval contingent on her obtaining the funding from the New York State Health Foundation. There would be no cost to the county other than her time, you know, for out of the office.
Right.
My thought was just, it's education for $1,000 if it's going to help Rob and his committee.
What
Why
is-
wouldn't we try to source it through the contingency fund if it's just $1,000.
Do you have $1,000 in your budget or a portion thereof in case the outside funding is denied?
Probably could find that.
We could do a joint, maybe?
Actually, we do have funding. Harry's telling me we still have some balance of travel, so we probably could just fund that right out of our own travel.
So we're just looking for a resolution giving her permission to apply for the grant and to go to the conference, is that right? All right, would someone like to make that motion? Supervisor McGowan, seconded by Supervisor McDevitt. Any more discussion? All those in favor? Aye. Opposed? Carried. Thank
Rob,
you.
if you wouldn't mind just getting the details to me in the county attorney's office as soon as you have it together, and we'll so we can word the resolution the way it needs to be worded.
Yeah, I'll get that together. This came up relatively quickly, so I just didn't have a chance to do that today. My apologies.
Thank you.
All right.
Yeah,
Thank you.
Thank you.
And a good job on the budget, gentlemen.
Thank you.
Okay, Dee, it's your turn.
Mind passing it down, okay.
You do?
Such a far reach!
Get the whole packet? I get it. We're all set?
The first item on the agenda is permission to renew our contract with the Hamilton County Department of Social Services to provide HEAP application assistance to residents of Hamilton County. And what happens is they reimburse us $10 for every application that we provide or we assist with. And also permission to do this again annually if there's no changes.
All right. Supervisor Sokol makes a motion, second by Supervisor McGowan. Any discussion? All those in favor?
Aye.
Opposed? Carried. Thank you.
The next item is permission to renew our contract with Hunt's for pest control at all of the meal site locations. Currently, we only have the agreement for 4 of them, and we wanted to expand it to all of them. And then they also increased the every other month visit from $50 to $75. So there's a total overall increase of $150 for the year, but we do have the monies in the budget.
All right, someone like to make that motion? Supervisor McGowan, seconded by Supervisor Sokol. Question?
Thank you. The Chester Town Hall is serviced by Orkin, and we include the meal site as well as part of the overall program.
Okay.
So how would that affect the town to have, and our charge for the town hall is about this much.
Well, if we don't need the services, we wouldn't have to call them in.
Okay.
So as long as you're providing it, we wouldn't need to have them come in, but I'd like to have it included in the contract just in case there's something that's specific to the meal site.
Okay. Could you reimburse us for it?
For your current pest control,
Sure. We're taking care of the meal site currently.
You're
Why'd you
also
bring
taking
this
care
up
of
a
the
long
rest of
time
the
ago?
building. Mr. Leggett. Oh, any more questions, or can we make a motion on this? We have a motion on it. Okay, we have a motion. We need to vote on it. All those in favor? Aye. Opposed? Carried. Thank you.
The next item is permission to fill the vacant position of meal site cook number 7 at the Long Lake Meal Site due to resignation. And this position is reimbursed by Hamilton County and federal state funding.
All right, someone like to make a motion to approve that? Supervisor Sokol, seconded by Supervisor McDevitt. All those in favor?
Aye.
Opposed? Carried. Thank you.
The next item, I just wanted to go over how well the senior picnic went. We had over 230 people in attendance, which is an increase from last year.
Oh, wonderful.
We did want to specifically mention a couple people that assisted with us. The Warren County DPW, Building and Grounds Department, in particular Brenda. They helped us set up, take down, and they let us use some tables. Countryside Adult Home allowed us to use their grill, coolers, and they also made the biscuits for the strawberry shortcake. Cornell Cooperative Extension allowed us to use some of their tables. The Warrensburg School allowed us to use their chairs. The Lake Luzerne Meal Site made the coleslaw, and the Bolton Meal Site made the macaroni salad.
Very nice. It's nice that you acknowledge all of them. It's great. Thank you.
The next item is the 2019 budget review. I did the top sheet. I did a breakdown of each of the different programs that we have, what's covered under that program, how much is funded by the federal or the state government, and the maximum amount of funding that we get from them. So it will give you a breakdown and an explanation of what each thing is. Overall, with our budget, we had increases, of course, in the fringe, the salaries. We were noticing a trend in the decrease in the amount of the contributions we were receiving from the individuals that receive the services. And then I also wanted to note that we do currently have 3 positions that were vacated last year that we have not filled, but they are still in the budget to be funded for next year in case we need to fill them. And those positions are the meal site manager number 10, which is the one up in the Lake Pleasant meal site. This one she left back in January, and things have been going very well there, so it's probably one that we may be able to delete from the table. The next one is the food service manager position at Cedars. This was recently vacated, and we want to see how things go before we completely take it out of the table of organization. And the last one is a service specialist position in the Office for the Aging itself. This individual had been specifically hired to help with the New York Connects program, but instead of filling that position, we've dispersed the responsibilities throughout the entire Office for the Aging, and we still get to utilize those monies that are 100% reimbursable out of the New York Connects program.
Okay.
I feel like the Lake Pleasant position we should hold open and not delete it this year.
We could possibly delete it this year because it has been almost a year and it's been working very well.
So who's covering it? What kind of...
What we did is the Wells meal site, they had 2 staff members and Lake Pleasant had 1. All of the meals were actually prepared in Wells for Lake Pleasant.
Yeah.
So we had a driver transporting it over, and then the person at the meal site would just serve it. So instead, we're having the second person at Wells transport it over. She stays and has the meal site open for like an hour, and then she goes back to the site. And it has been working fairly well. Unfortunately, we haven't seen an increase in the participation at the site, but we have realized the cost savings because of not having a specific person for there.
Okay. Questions? Anyone else?
I guess I'd like to propose that we delete that position.
What's your feeling on that, Dee, if we delete it?
I don't think that we need the position, but I would like to reach out to Hamilton County Board of Supervisors first because it is one of their positions.
Right.
And overall, it wouldn't impact the Warren County budget because it is reimbursable by them.
Right.
Okay. All right. Yeah.
That makes sense that you should do that first. Mhm.
I agree with
Any other questions?
that. I understand.
That doesn't impact our
Well, if you
budget.
get home and you look it over and you have loads of questions, you can call Dee at her office.
And ours is rather
Answer this for me.
complicated because we've tried to restructure the whole entire budgeting department
Right.
to have everything line up correctly. So what you might have seen in one area last year is different this year and the year before that. But overall, the expenses are the same and the revenues are the same except for that decrease in the contributions that we noted.
Right.
Dee, thanks for the overview by program. That's helpful to have.
Yes, it is.
True. Mr. McGowan?
Dee, do you, Do you know why we've probably had a decrease in contributions, just because of the fact that money is tough to play everybody?
We're not quite sure. We saw a decrease last year as well, so I don't know if just people are having a harder time contributing monies. We are working, like I mentioned at the Budget Committee, that we are doing letters now to try to encourage people to make contributions if they can, but it is all voluntary. We can't require it.
Correct.
We're
Makes
not
a
allowed to.
difference.
This is,
Oh, Ms. Bramer?
thanks. Are you talking about the cash that people give?
Yes.
Is
And
there any concern that,
I'll say it, they're not making it back to the center?
Well, we have a process now where 2 people at each meal site, they have to account for all the money. They deposit it at least weekly. Cedars does it daily. And then we do kind of track it to see if there's a sudden decline or decrease in the amount that we're getting. Unfortunately, there's no way that we can oversee the volunteer drivers because they're usually the ones that get the cash. But I do feel that most of them are, if not all of them, are contributing the money. They're bringing it back to the site. But there's no really way to control that.
The controls that you have set up, the state, I assume, has reviewed those when they come in?
Mm-hmm. And we have a program instruction that tells us exactly how we have to do that, and we follow that.
Mr. Leggett, did I see you?
Yeah, and we're talking per meal. What's the cost per meal?
$3 per meal.
$3 per meal.
And that is average across the entire state.
Mhm.
That is about the average.
And that's a meal delivered to your home?
Or the congregate meal.
Or,
Yes.
yeah.
And we can also get contributions for the home care that's provided, the transportation, things like that as well. Any program that we offer or service.
Yeah, you know, it should be noted, this is an excellent value, the meals that all these meal sites produce, you know, for a contribution of $3 is, you'd be hard pressed to make it
Yeah, isn't
at
that
home
the truth?
for that much.
All right, Mr. McGowan?
No, I feel what you're doing by sending out the letters and, you know, making people aware, I mean, that's really the best we can do. And I would really not want to believe that our, you know, our drivers are, you know, we're not talking a whole lot of money, but every dollar counts, so I appreciate all you're doing. Thank you.
And I do think that letter is a good idea, just a reminder if nothing else. But in my town, they're guilty too, because I'll hear the gal at the front desk say to the driver, did anybody give you any money today for your lunches? And they're not coming up with the money there either. So just kind of like all areas, and I can't quite figure out why they think somebody's going to deliver the meal to their house, but they don't expect that they should have to pay anything for it. So it is all... Ben?
Thank you, Chairman. Is there a possibility of a system where an individual could take a monthly one lump sum payment shortly after they receive their Social Security benefit as a way of better managing, you know, their money?
send it by check?
Send it by check and like they would do for, you know, their rent or wherever they're living, you know, make it easier for them. They don't have to remember that, and if they make a payment for, say, $45, if they only make it over their 12, it would roll over to the next month. I mean, it's a little bit more paperwork on your behalf, but could that maybe help some people out?
We do get checks from some people, and typically the only cash that we get is small amounts, like if they're just paying for that individual meal. I mean, we could possibly try doing something like that, but I don't know if that would deter people from giving us money if they have to give it all at once. Sometimes they just go in their
Well, it's an
pocket and
option. I'm saying it's an option.
as an option, they can always send in a check.
Okay, all right.
Yes, and we do encourage that. We have tried to see if there's a way where they could do it by credit card or an automatic withdrawal,
Right.
but that's not allowable at this, or it's not something we're set up for in the county at that point, because that would make it a lot simpler.
Right.
But we don't have that. But typically, like I said, when we're getting cash, it's only like $3 that we're getting. We're not getting a large amount. And those individuals that do pay on a regular basis, they're usually doing it by check.
Okay, any other questions, Mr. Leggett?
Just more of an observation that perhaps the decrease in contributions could also be because it's seen as a government program, and usually you don't have to pay for a government program. You know, so to be asked to contribute, I mean, we can use the restrooms at Exit 18 and not pay anything. You know, it's provided by the government. So, you know, it could be just that it's not connecting.
All right, anything further? Mr. McCowan?
About name tags, and then, you know, we accept cash, credit card, check.
Well, we can't accept credit cards. We can't accept
Apple
checks.
Pay.
Yeah. And we do have contribution envelopes that we send out once a week to all of the home delivered meals, and right on it, it does say you can make out checks, and it says who it's made out to.
So you're definitely trying, and like I said,
Yeah.
it's just a trend. I know money is getting tougher for everyone, so.
I mean, I do everything electronically. I don't carry cash, but
Well, that's the
our
other trend.
seniors, they definitely carry their cash.
Oh,
They keep it right on their person.
That's
They
true.
don't trust the bank, so.
The older people do have a little bit more cash than the younger people, that's for sure.
All right,
And
any
then-
further questions?
Yeah, so the bottom line is a increase of county carrying here by about 93,000?
Yes.
Okay.
And with that,
Just about almost 10%, 9% over last year.
yes, 4.4% is fringe increases, 3.1 is salaries.
Okay,
So
yeah.
that is 75,000 right there.
Yeah. Thank you.
Anyone else in the audience that has anything? Right, if not, then I guess we're good on Office of the Aging.
Thank you.
And thank you, nice job on the budget, Dee.
Thank you, good work. Thank you.
Chris and Julie, you're up.
That was good. So glad you were able to jump right in. It's okay. I mean, all people though are switching to, I can pass. Thank you.
Chris, how much these are?
I figured that.
Okay, good, good.
Yes, I do need it. We're all set, Chris.
Morning, everyone. The first item that we have is a request to reclassify a position of Community Services Worker number 2, which is a grade 8, to a Senior Community Services Worker, which is a grade 11. We are also asking to fill the position of Senior Community Services Worker as well. This is a position that has evolved over the years, and many more job duties and responsibilities have been assigned to this position, including supervision of another community services worker. So we've been looking at this for quite some time in regards to changing this position over to a senior position, which better describes the work and compensates for the work done by this individual.
All right, would someone like to bring that motion to the floor? Supervisor McDevitt, second by Supervisor McGowan. Any questions? Ms. Bramer?
Thanks. I see on the form it went through Jackie, and did it go through civil service?
Yes, I'd like to actually thank them for all their help on this. Trish Nenninger and Jackie Figueroa worked really hard on this with the state as well to get approval to make sure that this was appropriate, and they also worked with the union, so thanks to them as well for approving the pay grade level. So it was, I think her initials are on there actually, Trish Nenninger.
Yeah, Pete, that was...
Yes, yeah.
Yeah. Is this the right salary on the form notice of intent to fill, 37?
That would be the base salary for that position, grade
Base
11.
salary, but the person's actually going to make 46.5.
They've worked here many years, so there are steps that would...
They're up, okay. Thank you.
They're a long-time employee.
Any other questions? All right. All those in favor?
Aye.
Opposed? Carried. Thank you.
The second item is to request an appointment of Joshua Pachette from the town of Hague to the Warren County Youth Board for the remainder of this year. Youth Board representation includes members from the Warren County Board of Supervisors, municipalities, and 2 youth representatives. This is a person that would be obviously out of the town of Hague.
All right. Someone like to make that motion? Supervisor Leggett, seconded by Supervisor McDevitt. All those in favor? Aye. Opposed? Carried.
Thank you. I think the next item that I have is just an update on some things that have been going on over at DSS and some things that I've been directly involved in. Back in August on the 21st, Tammy Breed and myself attended the Warren County Interagency Collaboration Committee to plan our agendas and program for the 2018 to 2019 school year. We met with co-chair James Dexter, who is the BOCES superintendent for the region. On the 22nd of August, we met with Julie Montero and Edward Corcoran in regards to a budget review. And on the 28th of August, we had our formal budget meeting with the county budget officer, Frank Thomas, county executive Ryan Moore, and deputy county treasurer Robert Lynch, and of course Madam Chair Frazier. On the 11th of September, I attended the Warren County Risk Management Steering Committee to discuss ways that we could possibly improve some safety for employees and consumers at our building and in other areas of the county. On the 17th of September, we had our youth board meeting where our new preventive unit senior caseworker Lindsay Montaigne was introduced. Madam Chair was at that meeting as well. On the 18th of September, I met with Chairman Conover, Supervisor Simpson, Madam Chair Frazier, and Edward Corcoran up at Countryside to do a tour and have a meeting and discuss some possible improvements and a plan going forward, which was a very productive meeting. So thank you all for that as well. We've got a couple really good things going on over at DSS right now. On the 21st of September, I received an email from Sheila Poole. I was the acting commissioner for the OCFS, and this letter was in regards to our statewide foster care Title IV-E funding. There was a review and audit statewide, and I'm very pleased to announce that this was a success, because we were pretty nervous because they pull a lot of cases statewide. They pull 80 cases, and if there's more than, I think, 5 cases that are deficient, we could stand to lose some funding. There were only 2 cases found. The nice thing about this is that 8 counties in the state were invited to participate in the review process by sending a peer reviewer who assisted with this. It's quite an honor to be asked, and we were asked, and we sent Rachel DeRose, who is our community services worker, to this, as she is probably one of the foremost experts in 4E reimbursement in the state. She's been involved in a number of things over the years. So she traveled to Albany as a peer reviewer and really made a good impression. I got the email here. It's very short, so I will read it because it's nice to hear. This is again from Sheila Poole, who's the acting commissioner of OCFS. She wrote, "Good afternoon, colleagues. I'm delighted to share the exciting news that New York passed this week's intensive review of 80 foster care cases with flying colors. Errors were found in only 2 of the 80 cases reviewed. During this morning's debrief, federal reviewers commented that this was, quote, the best 4E review ever in New York State, end quote." And then she wrote, "We owe a debt of thanks to the following county staff who served as on-site peer reviewers. They were acknowledged by both the federal and state team as being exceptionally skilled and diligent." And Rachel DeRose from Warren County is noted on here, and it says congratulations to all of you and the OCFS team. I can send that around if you'd like to take a peek at that. So that was very nice to get. The last thing that I would like to mention is that we recently posted the Deputy Commissioner position, and we've had several very promising applicants already, so that's a good thing. I met with Eligibility staff the other day to discuss some office moves to more closely align with their functional areas, so we're getting things not only organizationally the way that they really should be, but also physically, people sitting in areas that are that make sense and they're going to improve some efficiencies. The last thing I'd like to do is thank everyone here for approving a resolution back on July 24th to amend the county budget in the amount of $50,000 to reflect receipt of funding from the New York State Office of Temporary and Disability Services in regards to SNAP bonus funding program, where we are getting $50,000 and have already got that and started buying these items. So thanks again, Julie, and everyone here for approving that. Julie worked very hard on getting that together, and it was submitted to the state. The application was approved, and we're already getting a lot of new equipment for the state that the county doesn't have to pay for.
That's wonderful. Terrific. Thank you, Julie.
That's all I have.
Okay, so it's Julie's turn, I guess. If we start with the overtime report, pretty much CPS is staying at right. The calls just keep coming. There really isn't a lot we can do about that. And then the other area that's up is in the training, which I think I had mentioned. We have 3 caseworkers that are going through core training now. So I think I had warned you that the training hours would be increasing while they're going through that. So hopefully another month or so, and we'll see a decrease. And then the budget revenue report, if you compare it to this time last year, our expenses are down a little bit and our revenue is up a little bit. So that's kind of a nice thing. I don't really have any concerns. We're looking like we're going to be on target to stay under budget through 2018. And then if we want to move on to our 2019 budget, there are 2 top sheets that sum up the social services, all of our budgets, and they compare them to the 2018 adopted budget. And there's 2 because one is what was entered into the accounting software, the New World program. However, at the budget meeting, there were some things that we did request. So the second page actually is if we got everything that we asked for, what our budgets would look like. And if you look at the county share increase,
at the most, it would be 1.32% increase, as if we got the increases that we've asked for. And I did put notes on there. The things that we asked for were 2 new caseworkers. One of them would be under raise the age, so it's 100% reimbursed. And then another one in our CPS unit, which would hopefully reduce overtime. We would be deleting 1 position on the second floor, a principal social welfare examiner, so that hopefully would kind of be a wash. I did ask to include the on-calls in our budget. They're a little over $21,000 a year. They're given. We have to pay that. We pay 2 workers every day. And that's quite a bit of money if it's not in the budget to have to try to absorb. And in the countryside area, we had gotten permission to fill a part-time laundry worker, which is a lot cheaper than the contract we had to send the laundry out. And so we're anticipating filling that, so I had to increase the budget there. And then the only other thing would be all the non-union wages at 2.6% increase, which is what the current CSCA contract increase is. So I don't know if you want to go over any specific budgets.
She does have them all listed there, so if there's one in particular that you have a question on, then feel free to ask her to explain whatever's happening there.
Just very briefly, 6010 is the administrative, so the increases there mainly are salaries and benefits. If you look at the 6100, that's the Medicaid, which we're projecting to go down a little bit this year, and that is all county costs, so that's kind of huge to have that go down. And then the only other one that really is a lot different than last year is 6129, which is the state training secure detention, which hadn't been used in several years. And we've had 2 kids placed there this year, and it's about $500 a day per child. So I did put in quite a large amount of money because the trend seems to be going in that direction, and it makes me nervous to have 2 kids there and to not have had any money in that area. So I did put $250,000 in there. It will be reimbursed 50%, which
What is the criteria? Why would a child be...
I believe these are through the
Yeah,
court.
if a child is in court and they're adjudicated juvenile delinquent, or JD, if they are placed in a voluntary facility, not a state-run facility, initially, because generally children are placed in the least restrictive setting, and these least restrictive settings are less expensive. However, if they get placed in one of these settings and they get in trouble there and continue to get in trouble, and we try other facilities and they're unsuccessful there as well, they end up going to the state. And the state actually takes custody of the child at that point, but we have to pay for it because they're from our county. So this is something that a family court judge would adjudicate in the court. We don't choose to put them there. The judge will say, okay, this is what's going to happen now. You're going out to this particular facility.
Where is the state training school?
There are several of them. Most of them are in the western part of the state that children that we work with go to. I think there's 6 or 7 of them. And we don't choose the place they go. It's based on where they have an opening and what the needs of that particular child are.
Julie, what's the revenue source on that 50% reimbursement? Is it a block grant?
It is a grant from New York State. Unfortunately, I kind of condensed the budgets for today's meeting, but the backup is with the full budgets.
Right.
Showing the actual, it had all the different facilities, what the cost per day was, and what the reimbursement rate was from the state on it. That should be with the full budget.
Thanks.
Yes.
Does this reflect the raise the age with the additional year child coming into play this year or next year?
The only raise the age I have built into the budget is the cost of one caseworker, only because there's still a lot of meetings on this as to how all of this is going to work. Probation is going to end up with a lot of the raise the age. Yeah. So for this year, really, because we don't know how many kids are going to be affected, where they're going to be placed, those kinds of things. So I haven't put a lot of raise the age into the 2019 budget, other than that.
Elaborate on that a little bit more as well. The Raise the Age children are going to be 100% reimbursement initially from the state. So, you know, it's not initially, I mean, who knows how long that will last, but the initial 2 phases for Raise the Age are going to be 16-year-olds starting October 1st, and then next year 17-year-olds.
This October 1st?
Yes, this
Like as in
October.
2 weeks?
As in
Or
2 weeks.
a week?
Yes.
5 days?
Exactly. We have been given a forecast based on our county and the demographics and court activity in various areas of the county that we could stand to possibly see up to 5 children come in the first wave and 5 in the second wave. So that would be
16-year-olds, and then next year 17.
Then next year 17.
Right.
Yes.
Okay.
Exactly.
5, but that's 5 at $500 a night for however many nights.
No, they wouldn't be going into these secure facilities.
Yeah, this would be a
necessarily.
different
Well, what if they
facility.
did, is my point.
We're hoping
No.
with this caseworker who's going to be working very closely with all the different agencies, and the goal is
to keep them out of placement. Probation's really going to be tasked with working with these families and these children very diligently to keep them from being placed as a Raise the Age child. We're going to have a Raise the Age worker at DSS as well that's going to be part of this process. And any children that get placed within the Department of Social Services will have a specific caseworker who works with that child and family to get them out of the placement as quickly as possible.
Is that the additional expense you're talking about, adding the caseworker?
yes,
And that's reimbursed at what rate?
100%.
100.
And if we found that the cost, like for the facilities, once we have a cost, we could come to committee, ask to increase the budget by that amount, because we'd also increase the revenue exactly the same, because
Well, I
it
mean,
is
we don't have a lot of
100%.
control over that, but to the extent that we can keep kids out of those facilities, I think that is beneficial, not just from the budget side, but from a social services side. I mean, they're going to be far from their family.
Yeah, that's one of the
Probably not
concerns that
great
we do
environment
have.
for a kid.
That's why we wanted the caseworker, because really a full-time dedicated caseworker working with this population
right.
and working with agencies may make the difference.
Sounds good. Sounds like a good plan. All right, anyone else with any questions? Supervisor Leggett?
Yes, on the safety net, that's a contract,
Safety net.
2140?
Yeah, no. Safety net is when they have exhausted or don't qualify for other programs. And what I do for safety net is I base it on number of cases per year that we have that fall under safety net. And it has stayed relatively steady at 122 cases. And that's families. So I'm trying to keep the cost fairly steady because it is, the reimbursement is so low on it that it's a huge cost to the county.
How does home relief work?
They come in and apply through our temporary assistance.
Okay.
And basically, if they've exhausted other programs, if they've been on them too long, and they don't qualify for anything else, we really try to work with this population, like with our employment program, to try to get them employed so that we can get them off this temporary assistance.
There's all parameters on how long they can be on and how much they get. Thank you.
Ms. Bramer?
There's one more. Okay, what is MMIS that we get zero?
That's Medicaid share, weekly share that we pay.
That's a lot of money.
It's a lot of money.
Anyone else? All right. Thank you, Julie. I think you did a great job with the budget. Chris, nice things are happening over in that department. It's really nice to hear
Thank you so much.
changes that you've been making over there.
Madam Chair, thank you.
Yes.
Chris, you've been there a number of months now. How, one of the items that we had discussed during the interview process was the morale. How are things going over there?
I think the morale is improving in certain areas for sure. Obviously, you're going to have some people who you can't make happy no matter what you do. That's just the reality of life. But we have, I think there's been an improvement in morale. I think it's going to take longer than I anticipated to get it to where I thought it would be right now. You know, I'm just very pleased that everyone here is supportive of the stuff that's going on at DSS in regards to improving morale and, you know, maintaining not only a high level of morale, but being able to retain employees. You know, currently we've did a lot on the second floor that I think has been helpful. We do have some issues in other areas where there's not enough people to do the work, so they're getting worn down from the overtime and the reports and stuff, but we're working on that, and with the help of this committee, we are able to get some of these positions in place and filled, and I think that as we move forward, it will only continue to improve, so thank you.
I can add anecdotally, whenever I meet anybody who works at DSS, I always ask if it's better, and I haven't had anybody yet tell me that it's not. So I get good reports from employees.
That's good.
Very nice.
Mr. McGowan?
Yes, the same, I'll have to go along with Mr. Moore from my mingling, talking to people, really, there's been a good improvement over there, and I want to commend you really for coming on board and doing what you're doing. I think it's great.
Appreciate it.
I guess it's Edward is up next.
You want your clip back?
Yeah, those are expensive.
Let me see. I have mine. I'll hand these. I'll hand them down. How's that? Thank you.
Morning. The first item I have here is an action agenda item, number 3A, a request to ratify the actions of the chairman of the board to execute a contract with LaPan Precision. The rationale is for emergency installation of a freezer, condenser, and evaporator for the walk-in freezer. I've enclosed a request for a new resolution for a request for a new contract. This is not the result of a bid. Again, the purpose is to ratify the purchase with LaPan, their address and contact number, commencement date September 21st of this year through September 20th of 2019. The total amount of the project is $5,500. LaPan has requested 50% down, which I believe we can do with a credit card,
and then the remainder 50% upon completion of the project. The code, the budget and object code would be A6030-413.
All right, someone like to make that motion? Supervisor McGowan, seconded by Supervisor McDevitt. Any discussions? Go ahead.
Is this already done? It was an emergency and this is ratification, so.
Yes, it hasn't been installed yet. The installation date has been scheduled for next Tuesday,
Okay.
the 2nd, at 9 a.m.
You have a freezer currently?
Mm-hmm.
Okay, good.
Yep.
They did a temporary repair, didn't they?
Well, from my understanding, they've been doing repairs for a long time now, and it's really a patch job, so we really need to move ahead with a new unit.
They do wear down. I mean,
Mhm.
if anybody knows refrigeration, it's a continuous cycle. It just keeps going round and round, and just like the car engine and everything else, they do wear down. So, and I feel for the walk-in coolers and that size, it's a good price.
Right.
They are reference.
Yes, we heard good things about them.
All right, all those in favor? Aye. Opposed? Carried.
Thank you very much. The next item I have here would be the census and marketing update through the end of August. In the month of August, we had 2 admissions, no discharges. Currently, we have 33 full-time residents at the home. I also included the overtime report for your review, so you can look them over. Let me know if you have any questions.
One of the residents just turned 100.
Yes, one of our residents, centenarian now. We tried to get some news coverage on that, and I'm not sure, I referred them to the family, of course, so I'm not sure how that's going to go. But we did get some news coverage with our a picnic. We had over 200 people attend our picnic, including Sheriff Frazier and Supervisor Simpson. We'd like to thank them for coming. We also want to thank the Cornell Cooperative Extension for loaning us some tables, and also County DPW for loaning us some tables and chairs. We did get an article in the Photo in the Adirondack Sun about the picnic, and also ironically it was National Grandparents' Day, so we had some grandkids there as well. And at the picnic, what I thought would be good was that we presented a couple of service awards to some of our staff who had been there a long time. So we did do that during the picnic, and they all received a nice applause for their years of service. And this was the picture and the article that appeared online in the Adirondack Sun. So we are getting some promotion, and we'll make copies of that and distribute it out to people and get the word out to promote the home.
It was a very nice event, though. Everyone was having a good time. They had a DJ there playing music. As Edward mentioned, they gave out awards. It really was nice. I had a good time. I was glad that I made the effort to go.
Yeah, thanks again.
Do we have anything else, Edward?
Just a point of interest, I will be away on some training courses in October and November for my continuing education credits. The training materials will include case management, possibility of extending services, adding more services, and also dealing with difficult residents. So I'll be doing that a couple days in October, a couple days in November, meeting people and getting good updated information on those topics and more.
Sounds good. And the laundry was in full operation the day that we took the tour. I mean, things seemed moving along smoothly. And didn't your own people do most of the work as far as installing everything?
Yes.
That was the impression I had.
Yeah, well, we did. We have our laundry now that we're doing in-house completely, and it's coming along okay. As luck would have it, one of the housekeeping people was out on medical leave for a couple of weeks.
Oh.
So we had only one cleaner who was doing both the housekeeping and the laundry, and then we had to juggle some staff around to get the other shifts covered. So it's been kind of a challenging way to get it started, but it's going well. And the good news is the cleaner who is on medical leave is scheduled to come back on Monday with no restrictions. So we'll be at full strength there. And so far so good with the laundry.
Okay, very good. Ms. Bramer.
And did the, maybe you already mentioned it, did the septic already start? septic work down?
No, not yet. The wastewater project, no, not yet.
No, I thought the sewer was going in right there.
Well, they were supposed to be drilling, it was this week, wasn't it?
They have a boring machine up there. I was up there for the Cornell extension, and they are
Right.
moving forward on getting it up the road. It just takes a little time to get that pipe in the ground. Yeah, it just doesn't go that fast.
But Countryside is connected to that.
Right.
Yes.
that's-
Yeah.
Cornell, yeah,
We
it's
eventually-
going all the way up to you guys and across. It's coming.
Yeah, okay, I haven't seen it. It's not on our property yet, I guess, but they are working on it, down the road.
If you come up from Warrensburg, you'll see that yellow machine on the left with a,
Oh,
you know,
okay.
that's the boring machine.
Okay, all right.
So they
They're
dig
getting
some
there.
areas and they bore in others, so.
Right. All right, anyone have any questions? All right, we're good then for social services. Thank you all very much. Thank you for the good job you do. Public health.
Public health.
Asked you down the hall.
Yeah, back. We can talk about this. Back.
It's in the new courts there.
Amazing how we react.
Yeah.
Had the same reaction.
Get these to Ben and see them come in and show
No, or what, you know, people look for that.
There was a lot.
The first thing people...
I don't know. Let me see, I have 1, 2, I have 4, 5, is that a form? I was 4 that was... Make sure.
Plus you.
Yeah,
You count as well.
So if we have 5, are we good then?
Yeah.
Okay, we're good. Thank you, you're welcome.
But no, it's right here.
Representing the county attorney.
Use that package, so it's much smaller.
Very much.
You're welcome.
Yes, nice to meet you. Okay.
From the old court.
Okay, it's
No?
Monday.
No. Leggett just left.
Oh, no, no,
He loves those big piles.
The new parts are just famous.
Makes it look like they want something.
Yep.
They got you.
Come on. My fault.
No.
Oh, you do have a packet?
You know.
I gave you a packet. Yeah. Oh, that's it?
You don't know.
We're all set, Janelle?
We're all set. Good morning.
Morning? It's almost afternoon.
The first resolution request I have is to submit application with Adirondack Health Institute for $3,000 grant utilizing the Public Health Improvement Plan funding to benefit families participating in our Women, Infant, and Child program. And we also would like to enter a contract with AHI commencing October 19th, which is the date of your board meeting, until the program activities have been completed, the monies have been expended, final reporting, and the final AHI approval has been provided. This is a great opportunity for us to benefit WIC families by providing and encouraging fresh fruit and vegetable consumption. According to WIC, 25% of the participating families are not consuming fresh fruits and vegetables. So this will be an opportunity to try to jumpstart and encourage the use of that. The timeline from the funding to approval and the deadline for our expenditure is very short, requiring us to accept the funding and also encumber that by 12/31 of this year. So that's why we're trying to kind of do a lot at once.
I'll move that,
Right.
Madam Chair.
Supervisor Sokol, you're making a motion to approve that, or second to that, Supervisor McDevitt. Any questions? All right, all those in favor? Aye. Opposed? Carried. Thank you.
The following resolution request kind of goes along with that first one.
I'll
This
move
is-
that one, Madam Chair. That's fine, I just...
Okay, you've read it over, you're
Yep.
going to, okay. Then a second, Mr. McDevitt. Any discussion? All right, all those in favor? Aye. Opposed? Carried. Thank you.
The third resolution requests to authorize a contract with David Minshall. He's a New York State licensed physical therapist to provide physical therapy services. Our health services home care agency continues to need physical therapists to deliver services to patients. And we don't want to be in a position where we're unable to accept patients needing physical therapy services. The therapy services are billable and revenue generating.
All right, someone like to make the motion? Supervisor McDevitt, seconded by Supervisor McGowan. Any questions? All those in favor? Aye. Opposed? Carried.
Next, we have a budget amendment. If you look at attachment 3, Ton will go through that with us.
Attachment 3 is asking to add to the budget for our health education program $1,000 in revenues and $1,000 in expenses. Basically what it is Dan's getting a lot of requests for CPR courses, and that's eating away at his budget, which isn't normally budgeted. We don't know what we're going to get for the year. So I just want to bring that budget up so it can cover those expenses.
All right.
And also, that's a revenue earning, so we can bill for those.
Okay, great.
I'll move.
Supervisor Sokol's making the motion, seconded by...
3A, 3A, 3B, and 4, please.
All right, 3A, 3B, and 4. You're going to move all of those.
They're all budget adjustments.
All right, are you in favor of that, Mr.?
Yes.
Second, Mr. McDevitt. All right, all those in favor?
Aye.
Aye. Opposed? Carried.
Aye, sorry. In favor, sorry.
Okay, thank you, sorry.
So just to clarify, we're now doing attachment for the budget adjustment, or was that in the...
That was in the...
You guys, oh, you did 4 as well?
Yeah, he included 4 in
Okay.
that.
You guys were quick. All right, as far as referral pending items, there are no pending items to report at this time. Jumping into Ton's report of revenues and expenditures, attachment 1.
Attachment 1 is as of September 17th, comparing last year to this year, and it will show you for current that we always like to look at our, this has as of July, just to let you know, we did get a new system down in our home care, Crescendo. We're working with that, so we've only just closed July. We're working on closing August. We have 2 systems going right now, so I want to make sure everything is there. So we've accrued that revenue into these numbers for July. Our salaries showing the comparison of last year to this year. We're slightly up by 1.17%. But also I want to bring note to your attention that at least year-to-date at this point, we're at 57.4%. That's one payroll into September of the whole budget. So we're just a little over 50%, where last year at this time we were at 68%. So even though the numbers are higher over the whole budget, we're still down there, staying very good. Attachment number 2 is again just comparing last year at this time, same time with payrolls and trying to make sure you'll see again all of the information. Our contractual allowances are slightly under. What we're doing is we just got our rates approved for our preschool program, and so we're working on, actually since this has been, we've submitted them, a lot of our summer school invoices are now being processed, that kids who had to go to summer school. And employee benefits reflect too, of course, if salaries are for nursing in particular, we are have some positions we're still looking for to fill, and so therefore the benefits on those. And revenues are slightly up when I compare last year to this year. So we're looking pretty good right now.
All right, next is our status of referrals, attachment 5. Val?
When you look back into July, we did have a little bit of a dip, and it almost looks like July of 18 was similar to June of 2017. And then when we move into August, the number was more comparable. In 2017 it was 96, and 2018 it was 119. So it just kind of looks like we just swapped months in that as far as the number of referrals. We do remain very busy, like Janelle says, and Tom, we do have some open positions. We just filled our LPN position, so we're very grateful for that. We are continuously doing interviews. We did hire one lady, but unfortunately things did not work out. But we're, interviewed somebody yesterday, and we're hoping she will accept the position. The hospital, from what I'm being told, is
census has been, it waxes and wanes. You may have, like last week, the phone was ringing off the hook here. This week, it's more manageable. One of the things that really concerned us is that some of patients' insurances have contracts with certain home care agencies, and we did get at least one person that I know of that with her insurance that she had, they had contracts with two of our competitors. And with that being said, if they would have taken her on as a patient, she would have had no copay. Neither one of those agencies accepted her as a patient for whatever reason, and we did. This patient, she had a trach and she was, very ill, but unfortunately she did have an $80 copay with our agency. But, we did go out and we provide this, the service. We do offer them a sliding fee scale if they're able to. So it was just one of the things that, for us, we take pride in that, that it wasn't the dollar, but it was this person that needed, and, it worked out with her. Right now, apparently, from what I'm told from Albany Med, St. Peter's, Saratoga Hospital, Glens Falls Hospital, that, the case managers there, the other home care agencies are again down with nurses. My only hope is that we don't end up in that same situation, because we've just had, so many people retire in the last 2 years because they've been here so long. So we're just trying to stay on top of things with, getting more nurses to come in. Unfortunately, we work so, fortunate for us, I guess, we work so much differently than our competitors in home care. Like, they have mandates that you have to have your paperwork done that same day. So although they provide them, and they do have to use their own car most of the times, we provide the vehicle. So, but a lot of the nurses look for, because they pay higher. But if you look at the fact that you're getting more money there, we have a nurse that came here from one of our competitors, and she just can't believe the difference. She said, I didn't have a life before because they were calling me all the time, and they'll just say, well, you're getting paid to do this because they do get a higher rate. But she's very happy here, and we're just looking to continue that. And, but we certainly do need to have more staff on board to be able to meet the needs of. One thing I just wanted to add too, when she was talking about this one patient, we tried to get a contract with this insurance, just to let you know, and I remember years ago, so did Dr. Ruggie with Hudson Headwaters. They felt they already had enough by working with the others, so they wouldn't give us a contract, even when we called and said, listen, the people you've contracted with won't even give the person the services. Anyway, I just wanted to let you know that we have tried to get a contract with this particular insurance, and we'll keep working on it, but at this point, that's where it lays.
Okay, thank you for filling us in on that.
All right. Our emergency response and preparedness reports on attachment 6, pretty straightforward. If you have questions after, I'll be happy to answer, but we'll jump into the budget summary with Ton, and there's an attachment in the back of your packet. And just before she starts talking, I just want to say that I appreciate Ton's effort. She put a lot of time and effort into this. She worked hard. She was very creative, and I'm hoping that you'll appreciate her hard work as well.
Okay, so budget summary. We met, and just ours is, I kind of color-code mine. So the yellow programs that you're seeing are our mandated programs that we have with us. One is the preventive program. Our director is part of that, and our medical advisor. The disease program, that whole program, and our preschool and our early intervention programs. Those are all mandated, and you'll see they total $4.3 million of our total expenses of 11.1. So the orange area, or the, I guess, light orange area, is all of our adjustments for payroll and fringes. We are looking at savings of $89,577 at this point is what we've requested. with each department, giving the total net effect to the county with our 10 different departments, a loss, I guess you could say, impact of 2.312,685 for our total. That is only 1.94% above last year, what we adopted for the budget. The WIC program and our bioterrorism programs are both grant funded and fully funded, so there is no impact to the county on those. If anything, one thing that's nice with the WIC program is they do also pay for indirect services like for plowing and mowing the lawns and other county attorneys and everyone who has to use. So we do get a little bit extra above for them. That's the only grant that does that. One thing which I know I always note, but I like to bring up, our retiree health. As she said, we've had a lot of people retire. Last year, what was approved in the budget for our total health insurance at that time was $284,736. Our 2019 impact is budgeted, and that's not knowing if anyone's going to be retiring, that's just what's current, is $352,091. So, a lot of that, most of that is our home care because of all the nurses that work there. And I do want to say that, you know, part of that, the home care is, of their loss that we're showing here, 89% of it is just strictly related to retiree health. So retiree health has grown up a lot. I mean, we started showing it in 2011. It is hitting our bottom line for all the departments that have, but it affects right now 4 different departments primarily that are being with any kind of retiree. The budget also is overall over last year's actual amount 3.04% above. So, you know, I know they say try to keep it so you don't increase it, but it's very difficult when you have salary increases, fringe increases, and of course retiree is part of that fringe. But we presented this budget as best as we could, and we felt that it's okay. It's going to be okay. And just to let you know that 65% almost of our bottom line impact are mandated, the preschool and early intervention programs alone. Our preschool program, we get 59.5 cents on the dollar, and our early intervention, we get 49% on the dollar. So, you know, right there you automatically have losses that are always going to be there because they're mandated programs. So I just wanted to bring that to your attention too. One thing I did want to note too was additional revenues that we don't reflect in the budget, which you'll see in like amendments throughout the year, is we do get cost of living adjustments from the state for many of the grants. Unfortunately, we were told this year, for next year's WIC, we will no longer be getting a COLA grant for them, which could range anywhere from $35,000 to $40,000. So we did their new budget based on not having that increase. But with our other grants, at this point, I haven't heard anything. Hopefully, we'll be getting some COLAs. Some other things that we hope that we will get additional revenue for is, like we just said, the AHI grants at Adirondack Health Institute. Whenever there's grants out there, if we can get them and they can help, we'll try to get them. They're usually not big grants. This one for $3,000 is probably one of our bigger ones, but we try to get grants as much as we can. And also our incentives through the state aid related, and also our DSRIP funds, which we try to get. Fortunately, a lot of that came this past year and a half or so has helped us purchase all this equipment that we've gotten for the Crescendo new program for our home care. So that's been a real help. Other than that, it's basic. One thing just to mention, nothing major, our health educator, he works both in the health education department, he does the tobacco, and he also does the bioterrorism. 30% of his salary is allocated to the bioterrorism grant, and 70% is allocated to the health education grant. And it used to be 40-60, now we've made it 30-70, so that is going to help a little bit there too. Anybody have any questions?
I think they've worked hard to come up with a good budget. As she said, she's been creative. I believe she has been. And she does have Ton has a concern about the retiree health insurance taken out of like their budget. It does seem to me like it should be put in a big pot for retirees, and that
I can address that. We do have good news on that front regarding the new health care plans that have been approved, that were approved on Friday by the board. I can just go through the different divisions. I have the printout here. for their administrative division. Of course, I flipped to the wrong page. The administrative division, the retiree hospitalization dropped by $30,000. For WIC, dropped by $9,000. These changes are not reflected in the budget that's in front of you. They'll be reflected in the budget officer column. In the preventive program, dropped, it looks like it was, I'm having to do some quick math here, about $10,000. Emergency, that's not theirs, but went up very, very slightly on EI. No, I'm sorry, I'm looking at the wrong account. There is no retiree health insurance in early intervention and preschool special ed. In bioterrorism, went down, again, looking at the wrong department. So overall, it did go down. The net kind of washed with the increases for health insurance for your active employees. That we'll consult with you on what we can do on the revenue side to accurately reflect what we're able to get for the active expenses as opposed to the retiree expenses.
All right. Any other discussion on the budget or questions?
Anyone else have any other questions? No? I guess we're good. Do you have anything else, Janelle?
Well, Val already hit the nursing positions. I do want to report for WIC, we're fully staffed. Knock
Great.
on wood. All the new additions are amazing, wonderful people. They just did their
terrific.
upgrade with their computer system. Now the WIC participants are going to be using like a credit card versus a traditional check, so that should decrease the stereotype. So everybody in WIC is incredibly happy, excited, and people are getting the new program, so WIC is like flying high right now.
Great.
So we'll celebrate with them and thank them for all their efforts. I did submit an intent to fill form for a registered professional nurse, CHN number 11. And then busy time of year for conferences. We submitted 4 approvals. One was for social media for natural disasters, which unfortunately due to illness we're unable to attend. Today, Janelle Oxford is at a home care emergency preparedness meeting that was kind of a condition of participation that we are at. Next week, I will be attending the Public Health Leaders Summit, which is an annual event in Clayton, and happy to report that I'll be taking the new Public Health Director training on the 3rd, so they've incorporated that as part of the conference this year. And then Val, our newly appointed Corporate Compliance Officer, thank you Tammy for that opportunity, she will be attending the Home Care Association's Corporate Compliance Training Symposium in Albany in October as well. So with all that, I'm done unless there's questions or concerns.
Any questions?
Could I just say, when we reviewed this department's budget, I noticed the timestamps on when they printed out reports indicated that they worked late into the night. Thank you for the thorough job on that. You did a great job putting it together.
We need to act on this intent to fill. Was that the one? Or so we need a motion. Supervisor McDevitt, seconded by Supervisor Sokol. All those in favor? Aye. Opposed? Carried. Thank you. Thank you, ladies, for doing a wonderful job. Tom, you did a great job on the budget.
Thank you.
We appreciate all the hard work you do down there. And Andy. Oh, motion. Sorry. We need a motion to adjourn. Supervisor Sokol, seconded by Supervisor McDevitt. Enjoy the rest of your day. Thank you.